Hello, I'm José Côté. I'm a nurse since 35 years. Actually, I'm full professor at the University of Montreal and researcher at the CHUM. I'm also the holder of the research chair in innovative nursing practice. My first study in the late 80s was with people with AIDS. I was very impressed with how these people cope with this stigmatized and fatal disease. It greatly inspired me. Since then, I have always wanted to put forward nursing intervention to better support them in their health challenge. The purpose of this presentation is to look back at the past decade of research on TAVIE. My team and I create a virtual nursing concept and an innovative platform to empower people with chronic conditions. TAVIE is a French acronym for Treatment, Virtual Nurse Assistance and Teaching. TAVIE translates in English as Your Life. TAVIE was developed by nurses, health professionals in conjunction with experts in the fields of computer science and art media. TAVIE was developed in the context of the rise of chronic health problems that pose daily challenge for the people who experience it. They have to cope with new medication, side effects, symptoms, pains. Considering the opportunity that offers the communication technology, the aim of TAVIE was to provide individuals with real-time tailored support in managing this challenge. Concretely, TAVIE consists of asynchronous interactive web sessions animated by a virtual nurse who guides people through acquired knowledge and developing self-management skills. In addition to provide customized teaching, feedback, and positive reinforcement, the virtual nurse refers to the experience of others, virtual patients, who have successfully managed similar situations. In TAVIE, the user patient has an active role, and she is seen as someone who has the strength and capabilities to be engaged in their health behavior. I will show you an illustration of TAVIE.
The obstacles we perceive can prevent us from adopting new habits. For example, you would like to change your eating habits but find that eating good fats is expensive, and besides, you don't like cooking. From now on, your job will consist of identifying the situations or obstacles that make incorporating good fats into your diet a difficult task. Just identifying the obstacles is a good start. I will help you identify them. You know, changing your habit is not simple. I asked some people living with HIV the following question: what are the things that prevent you from choosing healthy fats in your diet? And here are some of their answers.
I love olive oil, nuts, fish, and avocados, but those products are expensive.
If I paid attention to the fats in my diet more carefully, I would have to organize my meals more, and I would have to cook much more often. I don't feel like cooking more, nor do I have the time to do it.
I find it difficult to know what fat is good and what fat is not good for my health. Making healthy food choices is not easy.
When I'm hungry, I feel like eating everything in sight. And it's not carrots or celery I'm particularly interested in.
Since 2008, we have created 11 TAVIE interventions to support different clienteles with health problems that requires personalized, continuous follow-up. First of all, we create VitaVie. It's an intervention for a person living with HIV to help them to cope with medication. We create again in the domain of neurosciences. So we create a TAVIE for Parkinson's patient epilepsy patient. In cardiology, we create a TAVIE for patient who has a cardiac event who is beginning to walking. And in other domain, we create a TAVIE for a patient who has a kidney transplant, patient with pain, and in oncology. Over 1,000 pre-recorded video clips are present on TAVIE based on pre-programmed algorithms that allow to tailor the web-based content on specific individual needs. As recommended by the NIH, we proceed to the 4 phases of research on intervention. First of all, we use intervention mapping to create TAVIE. Intervention mapping, it is a systematic and iterative approach that allows us to build TAVIE based on theory, empirical evidence, and substantial contribution from the clinical and community environment. Also, with the experiential knowledge from the user. These interventions have been pilot tested, evaluated through mixed design, quasi-experimental studies, randomized controlled trials. For the purpose of evaluation, we have also developed online RCT, in which all the steps of the traditional randomized controlled trials have been transposed to the online research. Recruitment, randomization, measurement, and participant follow-up. We conduct 2 online RCT, the HIV Medic Online and Live Healthy. In that past decade research on TAVIE, evaluation with diverse clienteles in different contexts support the acceptability and feasibility of these interventions. Participants have appreciated the general approach and have perceived various personal benefits in terms of emotion, cognitive, and behavioral. Some improvements have been notified in relation to pain and quality of life. In creating TAVIE, it was very essential for us to establish a certain relationship with the user by the virtual nurse. The image of the nurse was placed strategically in the middle of the screen to promote a close contact with the user. Various visual perspectives have been chosen by the audiovisual team to fit the image of the visual nurse to the content of our intervention and make the web consultation more dynamic. Qualitative results suggest that the virtual nurse humanized the experience of the web base. Numerous persons had the feeling of being accompanied and of interacting synchronously with a nurse. The human and warm dimension of the intervention was emphasized by the participant. However, in the context of digital health, we must be aware and very careful not to widen the inequalities gap. We have to keep in mind that innovation often involves the access of technology and resources. In all technological development, our focus must always be the patient and the family in their health experience. Providing nursing care with digital health has challenged the traditional way of engaging with patients. The expanding technology seems to be indispensable in taking up the current challenge of availability and continuity of care. I would like to acknowledge the funding partners and also thank you. Vous dire merci et au revoir.